by bringing nurses out of their usual ordinary settings and giving them exposure to how things are done in other parts of the world, they can come back and actually be better nurses.
So this opened my eyes just to see the beauty of the classic works of art, the beauty of the structures and the architecture. And this leads to healing of the soul, healing of our being. A life-changing trip, and definitely helped me in my views of nursing and how to care for people.
Actually, who would think that art can be interrelated to this discipline of nursing?
During the trip, I had a lot of questions and requests to elaborate on each topic that we discussed, every work of art we saw, every writer.
And when you get there and you see it, and like when I saw the Pieta, it just moved me. I started crying. It was a mother holding her dead son.
There were so many similarities between what we do here and what they do there in the operating room. We were able to see a couple of the surgeries from the window, talk to the surgeons.
And how they had units set up within the hospital. It wasn't so much a specific unit, but they actually had levels of care. So a person would go to a level of care as opposed to, they need surgical.
The emergency room isn't their first line of defense in Italy. It's the primary care doctors. They have a network that they can go see different clinics.
That people in Italy pull together for their disabled, though, in a different kind of way. I was going to Venice, and as you know, there's canals, and it's very difficult to go from one canal portion to the next because you have to do stairs. Without being asked, several big husky Italian men offered to actually pick me and my wheelchair up and push me and walk me with the wheelchair over to the next area, which meant that they were going up probably 20 stairs up and 20 stairs down with me.
System. The ambulance is equipped with a doctor, a nurse, and a driver. So I think that was phenomenal right there.
In Italy, it spoke to me on a personal level because in that country, although they may not have all the advancements that we have, I think the physical touch, nature is it's a healing vessel in itself. It's okay to touch each other there, in a respectful manner, of course. But sometimes in nursing, that's all that you need.
It just was fascinating to learn that they have much better outcomes in Italy than we do in the States with sickle cell disease, which would blow most people's mind away because we think we're the best in everything.
We did visit one hospice center where families are allowed to stay, live with their sick members of the family in that place. These patients have only a few days or a few months to live. The family just want to be there with them up to their last breath.
It's made me want to go on more trips to see where else in the world. How else do they do it in other parts of the world?
When I brag to my to fellow peers and about, I'm going to Italy. Oh, really? Is it a vacation? No, it's a study abroad program through the University of Hartford. The one thing I always hear is, I wish my university did that. They don't have that. I said, you better come to University of Hartford. That's where it all happens.